My name is Dr. Mcharo. I'm a Tanzanian research scientist with the National Institute for Medical Research, Mbeya Medical Research Center. I'm also a Ph.D. Student sponsored under Thrive 2. And in terms of this trading with AFIDEP, I got to understand and to get a picture of how complex and long the policymaking process is. But also that despite the complexities, it's very crucial to have evidence-based decisions for better policies. I got to learn about the policy-making cycle, issues of how to set the agenda, formulation, implementation of the proposed policy, and review. And as the word goes, it's a cycle. So I got to learn that it is a continuous process. And also the issues of how to utilize the window of opportunity, that anytime, anywhere, you may get your breakthrough chance and you need to grab it. I learned how to best communicate the messages that we need to send across and how to identify and work with relevant stakeholders. And if I can quote from one of the sessions, it was said that influencing is always about creating and sustaining meaningful relationships. And so this is very important for us in the work that we are doing. And during the subsequent webinar, with examples and hands-on experience, I got to further understand and how to apply the skills that we learned specifically on the project that I'm currently working on. The webinar was a follow-up also to what we have learned and sort of set in place even better on the materials that we were given. And as a way of applying skills that I learned in my personal research work, I had earlier on started with community engagement, engaging the administrative personnel of higher learning institutions in the region, because I'm working on sexually transmitted infections among young adults, 18 to 24-year-olds who are in higher learning institutions, so universities and colleges. But apart from the administrative personnel that I had engaged with prior, I had also adopted a high school. So we are working with young girls in high school to share across the message on sexual and reproductive health, as well as prevention of sexually transmitted infections. But I do plan further to involve the media on my findings, as well as political leaders within the region, who I believe can help with taking across my findings, as well as recommendations for the better health of the young adults in our community. And so I would like to thank AFIDEP for giving us the opportunity to learn this very important aspect of the research world on how to communicate with those who may actually make a difference out of the work that we had endeavored to achieve. Thank you.